Hello, this is Talking Europe on France 24. Now, as this continent and other parts of the world start to emerge from their Covid-19 restrictions, which have seen families kept apart for weeks on end, we're asking today whether the coronavirus is starting to be behind us at all and whether Europeans are prepared in case it comes back. My guest is the director of the European Centre for Disease Prevention and Control, or ECDC. Dr. Andrea Ammon is the German doctor who heads up this EU agency. She was warning European states, in fact, back in January, that they needed to prepare for this virus, which would later see half the world's population put under lockdown orders. Dr. Andrea Ammon, thank you very much for being on the programme with us. So we are now more than halfway through 2020. The virus has been with us for most of the year. European states are opening up. Infection and death rates are much lower than a month or 6 weeks ago. Is this the end, or should we expect a second wave of infections later on?
Yeah, I mean, we know from several studies that it's still the majority of the European population has not been in contact with the virus. That means they still can be infected. And that also means that if you're not continuing to apply certain measures, there will be an upsurge of cases. I believe that what we have learned so far will help us to keep this wave or make sure that this wave is not as high as before.
Now, how concerned are you about recent news from Beijing that there's a new cluster of cases that has sprung up in that city that seems to have originated inside Beijing, meaning not brought in by travellers?
That just confirms that although we have seen a reduction in cases, the virus is not gone. And I think that is the main message that we have to convey, that although case numbers are decreasing, people still have to keep certain measures, and that is keep the distance, put a face mask or a face cover if it isn't possible, keep the hand hygiene, stay at home if they have symptoms, that they have to keep this nonetheless.
Now, here in Paris, certainly you see walking about the streets, only about 10% of people seem to be wearing masks, almost nobody at cafes. Do you think that this relaxation of restrictions has given people a bit of a false sense of security?
I think it did, and I think that is why it's so crucial, in our view, that this message is constantly repeated. We can't let down our guard now.
Now, what about decision makers? What should they be doing with regard to a second wave of infections? You know, stockpiling more masks, PPE, perhaps keeping the public partly locked down for a time?
I mean, we have said that what is very important when now the measures are eased is that there is a wide testing capacity in place, so that people, that really everybody with symptoms can be tested, that contacts can be traced speedily, and the surveillance system there is very capable of timely monitoring whether there's an increase. So that is something that has to be in place, so that if the situation is changing, that we recognize this very early on, so that then measures can be put in place.
And of course, all the while, a lot of work continuing, looking for vaccines, looking for treatments. I know that you tend to leave comments on actual treatments to the European Medicines Agency. But just speaking as a doctor, I want to know what you make of the news this week from British researchers that have successfully treated some Covid-19 sufferers, they say, with a drug that's existed for a very long time, dexamethasone. The British government's approved it for use right away in the health service. Just speaking of a doctor, what do you make of that news?
Well, I think without commenting on the specific drug, that is what is now happening. Beside the search for a new specific medicine against COVID, is how far medicines that we have available help in the treatment. And from my personal view, this is certainly a drug that will not direct or is not directed at COVID as such, much, but maybe at symptoms that are caused by COVID.
Just looking then at how we got to the situation where we are right now. Just in February of this year, it feels like a very long time ago, you spoke publicly and said that there was a low risk to Europe at that point. Now, did you at the ECDC underestimate how bad this was going to be, or do you believe that governments mismanaged their response?
I mean, what we said at that time is that it's low if cases are early detected and contacts speedily identified, so that it's that the infection is contained. At that point, in until mid-February, all the cases that we discovered in Europe had either come from a country where the infection was already known or had contact to a confirmed case. So every infection could be traced. I think it was towards the end of February in Italy, there was the first time where cases, or one specific case, could not be traced to any known confirmed case, and that is where it became clear that there is widespread community infection. It was also not known early on that the infection could be spread by people that have no symptoms.
So, early on there was discussion about the concept of herd immunity, allowing the virus to spread throughout the population with the aim of most people becoming immune and essentially eliminating the virus. Did you actually have any discussions with the governments you advise about trying for herd immunity?
We did not put this as a specific strategy. I mean, this is the result of a virus being long among the population or a vaccine, but it wasn't put forward as a specific strategy.
So, we saw Sweden and the UK, two notable states that took a less strict approach to the virus. Both governments have said that they didn't aim for a herd immunity strategy, but they were certainly less strict. Do you feel that their decision went against your advice and against the advice of scientists?
Well, I mean, our role is really to put options for response. And that is, we are, I as head of the agency, I'm accountable for that we use the best available scientific evidence in our proposal for options for the response. But it is the responsibility of the governments what they choose. And they are accountable for this.
Indeed. I suppose my question is, do you feel that governments did listen to your advice, drawing on scientists from all across Europe?
I think they took our options for response and modified it according to their national needs.
And just specifically on the UK,
I'm not in a place to comment on what governments did.
Well, just looking at the UK, for example, being one of France's closest neighbours and linked by the Channel Tunnel, for example, a former advisor to the UK government said that if the lockdown there had happened 1 week earlier, it could have drastically reduced the death toll. Was that in line with your advice to the UK as well?
I think that was also what models showed from China. Who actually put in this lockdown at the end of January, and also there the conclusion of the models was that if it has been done earlier, then of course the number of cases would have been less.
Now, well, staying with the UK, there's a lot of confusion here in France for a while about whether people arriving there from France would have to go into the 14-day quarantine that's currently imposed. It turns out that is the case. Travel companies, a lot of businesses are very upset about that. Boris Johnson, the Prime Minister, said a couple of days ago that this quarantine is in place to prevent re-importing the disease to the UK. Now that we've got it under control. The death toll in the UK daily is much higher than France, for example. In your view, is the UK's quarantine a useful public health policy?
We have in general said that when discussion now is of opening borders, that it's much more critical how people behave than whether the border is open or not. So it is much more critical and important that people who live in a country or go into another country, that doesn't matter, keep the distance, put a face mask, keep the hand hygiene, stay at home when they have symptoms. That is what is really the decisive factor. So it depends on everybody, every single individual.
Well, of course, borders are opening up all across Europe at the moment. The airline industry, particularly desperate to get the public back on planes. There is a lot of mixing and close contact in airports, in planes, though. Considering all of that, would you personally be happy to take a flight at this point?
I personally will avoid it if I don't have to.
And what would your advice be to people who are thinking about their summer holidays this summer?
My advice is that they should not assume that there will be summer holidays as they have been used, or we all have been used to last year. There still will be measures in place in terms of the hotel occupancy, in terms of the restaurant occupancy, in terms of keeping the distance. So I think we will have to adjust to a new way of having holidays.
All right, we are out of time, but thank you so much, Dr. Andrea Ammon, for speaking to us today.
It was my pleasure. Have a good day.
And thanks to you for watching. Stay with us here on France 24.
I'm Sarah Morris, France 24 correspondent in Madrid. I cover Spain and Portugal, two countries recovering from painful recessions, but now being challenged by the political and social fallout from those years. Watch me on Live from Paris and France 24 news programmes.
Sarah Morris, one of the 200 France 24 correspondents around the world.